Good afternoon, everyone. My name is Ken Phelps. I'm the Vice President of Resource Development with the Daytona Regional Chamber of Commerce. And I'm glad to welcome you to our program, Real Deal Discussions, COVID-19 Myth Busting. This, I think, is going to be a very valuable and informative session. Pleased to have you joining us, and as part of our mission to provide you with accurate information relating to the pandemic. A couple of housekeeping items before we get started. Please double check that your microphones are muted and that your cameras are turned off. We're going to hide the cameras of everybody but our moderator and our presenter so that everybody can see very clearly. If you have a question or comment at any point during the program, please submit it using the chat function. And if you mouse over your screen, you should see the control panel pop up. Click the More button with the three dots, and then you'll see chat. Click the chat, and that will go ahead and open up that chat function. You can submit any questions that are not covered in our topics. We go through the session today. If you missed something, we are recording this session. It will be available very shortly after the program on the Daytona Regional Chamber Back in Business Safely page, as well as on our YouTube. We're also going to be doing some interactive polling in our session today. So we'll go through a couple of instructions. Hopefully you received an email earlier today with how to download the app or to access the platform on your web browser. So if you go to pollev.com/DRCC, if you're online using a web browser, or open the app if you are using your iPhone or Android, that will get you situated for using the Poll Everywhere software. Depending on whether you're online or using the app, there's a couple of different appearances, very similar but subtle differences. Once you are enter your name. Reminder that the answers do not appear with your name. Everything is shown just in the aggregate. So, but we want to get some interactivity with you this afternoon. Once you get to the screen with a question, you'll see multiple choice. And if you're on your phone, you just tap the answer that you think is correct. As you do that, we'll see your responses starting to pop in as we go through each question. At that point, when you get to a screen, get like kind of a welcome to the presentation standby, you'll be ready to answer questions, and they will update on your phone automatically as you come into the question. So you can tap your answer and we'll see how well you guys know fact or myth today. Nancy's going to tee you up with your response, and then David will give you some background on that. So I think that takes care of our housekeeping items. Again, remember to mute your mics and turn your cameras off. And with that, I will turn it over to our moderator of the program, the President and CEO of the Daytona Regional Chamber of Commerce, Nancy Kiefer. Nancy, the floor is yours.
Thank you, Ken. Appreciate it. We are very excited for today's program. As we all know, everybody's inundated with information, so we're going to go straight to the source today, and we are going to determine whether what we think we know is myth or fact. So our appreciation to AdventHealth, who is a trustee member here at the Chamber, and for bringing their expertise. It is my pleasure to introduce today's speaker, David Weis. He is the Chief Operating Officer of AdventHealth for Daytona Beach. Prior to coming to our region, he served as Vice President of Operations and Chief Operating Officer for AdventHealth. I can't even say that now. Ukiah. Help me with that, David.
Ukiah Valley.
Ukiah Valley in Northern California. During his tenure, he developed a $172 million master plan to rebuild the medical center in its current location while maintaining all patient care operations. He is also passionate about leadership development and created and launched 2 leadership development programs to grow frontline leaders to their fullest potential. We have been fortunate enough that David actually participated in one of our Leadership Daytona programs, so he is a graduate of our local program. He began his career as a physical therapist at AdventHealth. During his 9 years with the organization, he held a number of positions before being promoted to Vice President of Operations and COO. He has a Bachelor of Science in Biology from Southwestern Adventist University in Keene, Texas. He went on to earn his Doctor of Physical Therapy from Loma Linda University in California. He also earned his Master of Business Administration and Healthcare Management from Quinnipiac University in Hamden, Connecticut. He is a licensed physical therapist and a certified GE Master Change Agent, which utilizes a robust framework to manage organizational change most effectively. I can only imagine how much that education has been helping you out over the last few months. He is also an affiliate of the American College of Healthcare Executives. So David, we're very, very excited to have you here today. And we've decided we'll just kind of tee you up with an opening question, and then we'll move into our myth or fact. As Ken mentioned to everybody, please also feel free to present questions through chat, and we'll try to get to those if we have time. So David, where do we stand currently with the pandemic as some of the key metrics that hospitals and the healthcare industry are using?
Yeah, well, good afternoon, everyone. I'm honored to be here. So as we're looking at what's going on within the current pandemic, we're obviously very closely looking at our total cases. But one of the really critical indicators that we look at is the positivity rates that we're seeing as far as new positive results in any segment of our community, as well as hospitalizations, because both of those factors indicate both the severity of illness that's going on within the population. The positivity rate is a great indicator for us as far as how quickly it's spreading. As we look at the state of Florida statewide, we've been close to 14%, 13.5% over the recent weeks. Volusia County has been a little lower, around 10% with that positivity rate. But keeping in mind that that's the recent data that we had coming out of July and into early August, when we look back at the first part of this COVID pandemic, we were running at 3 to 5%, and everybody was concerned at that point in time. So obviously the positivity rate has gone way up as we've seen that spread continue. But the really important thing for us is, I believe all of our hospitals here in Central Florida are well prepared to deal with any surges in volumes, and the current demand on our systems has certainly not exceeded what resources are available to make sure we can safely care for our communities.
Great. Well, certainly those are some of the metrics that are important. As we all realize, we look at different statistics through different lenses, and that becomes difficult when it comes to really understanding what we should be paying attention to. So you talked a little bit about the positivity rate and the hospitalization. Are you aware of any opportunity for them to go back in and update those figures as people come out of this and are no longer considered to be positive for the disease?
Well, the data that we look at is refreshed every single day, and so it's what we're looking at from live dashboards available to us through the Department of Health statewide. We certainly also keep a close eye on what Johns Hopkins reports out. They've been doing a very robust data gathering from around the world since the very beginning of the pandemic. And so, yes, these numbers are always refreshed. One of the interesting things, though, is we're quickly approaching 550,000. We're at 542,000 positive cases coming into data that was reported through August 9. That number just continues to grow. Now, many of those individuals have obviously recovered, thankfully, but that number is just an ever-growing number. The positivity rate is always adjusting based on the number of results that are coming back positive versus negative. So over time, hopefully we'll see that positivity rate drop back down to a much lower percentage as community spread decreases. And that will happen in due course when there are less new cases coming about every single day as we get testing results back. And then certainly from a hospitalization perspective, that's something that we'll continue to monitor, and it's a cumulative data statistic as you look at it for the state of Florida right now. We're really looking at how many people have been hospitalized since the beginning of that pandemic has started back in March, and we're looking at that number steadily climb, because it doesn't mean that's the number of people that are in a hospital right now. We've had 31,354 hospitalizations in the state of Florida since the pandemic began. They're not all in the hospital right now from COVID, but a large number are. And so we continue to monitor through state resources as well as internally. AdventHealth has a large network of care across Central Florida. And so we monitor our bed capacity on a daily basis. And we're seeing a drop down in the total number of new cases that are coming in and being hospitalized since mid-July is where we hit that high point. And now it's really kind of starting to flatten. We're still caring for a lot of COVID positive patients, but we're not seeing that exponential rise that we started to see as we approached mid-July, which we're very grateful to see that. And we are, well within the resources that are available to be able to care for the patient needs that we have in our community. What that means, though, is we still need everyone in our community to do everything they can within their power to continue to stop the spread of the virus, because it's definitely, even though we've seen a flattening, it's nothing that we can be celebrating about right now. We still have a long road ahead of us before we can really declare that the risk factors have significantly fallen.
Yeah, we appreciate that. I would be remiss if I didn't also mention that the Chamber also provides a tool on the website that monitors the positivity rate from the health department, so that we do provide that information available to the public. And that, again, is a rolling rate as well. So as we move about these particular numbers, you're going to see different things from different sources, but it's not that they're not right numbers. It just depends a lot on, again, the day which testing rolls over. So
that's right.
Yeah. So one of the things that we want to do to tee up the discussion is to really start with our polling questions to give you some idea on where the community stands. What we think we know out there, and we have somewhere, it looks like around 50 people on this call right now. So hopefully they've all keyed into our Poll Everywhere software that we have. And if they have, then this question will come up automatically for them. And as you can see right now, people are already starting to respond. So that's a good thing. The first question for anybody who might not have access to the screen is fact or myth. Wearing a mask keeps me from getting the virus, and in parentheses, to wear or not to wear. And right now, as we watch the statistics moving around the screen, we're at about a 57% fact, a 41, okay, the numbers continue to move. 61% facts, 39 is a myth. So about 2/3 are saying that's a fact. Looks like there's still just a little bit of movement. But let's go ahead, David, and start to address that particular question. You will see that this is a live polling, so it moves a little bit, but you can really start to see the numbers are somewhere around that 60-40, 60%.
So, yeah, that's great. This is an interesting one, because the reality of this is it's actually a myth. And I'm going to qualify what I'm going to say about that, because I think this is really a very, very important topic that's probably been very widely misunderstood across our country, as well as within the state of Florida. So while it is a myth that wearing a mask will keep you from getting the virus, the qualifier there is that there is no guarantee that anything's going to keep you from getting the virus, right? But wearing a mask, we do believe, is really the number one thing that anyone can do to prevent themselves from spreading the virus, as well as to reduce the risk of getting the virus. And we look at this within our communities and across the country. Right now within AdventHealth, everyone that comes in the doors of our building is required to wear a mask. All of our team members, all of our patients, all of our visitors, when they're in close interaction with others. And part of the reason for the benefit of wearing masks is the masks actually help as much or more to keep you from spreading the virus if you happen to be an asymptomatic carrier to other people, versus always preventing you from potentially getting the virus yourself. And the way that it works is it helps to stop the droplet spread from potential coughs or sneezes or other things that can aerosolize it into the air and allow it to be passed on to other individuals in the area. And so I want to say that this is a myth with caution, because while it doesn't guarantee you from not getting the virus, it is about the most important thing that you can do to protect yourself, to protect your family, and really to be a loving neighbor to your community. It's one of the most important things that we can do to drop the spread of the virus, and something that we strongly advocate and encourage in all settings.
Yeah, I think that's a great message for our business community and our residents to realize that part of this is some personal responsibility to help stop the spread. And, we've been talking a lot about back up, mask up, and wash up. And, those are three things that we can all control. So appreciate, your input on that topic. I'm sure there might be some questions later on to move a little bit further into that. Let's look at the next myth buster. And okay, there we go. That's Ken, I think we skipped one. Okay, there we go. We have fact or myth, COVID-19 is having an impact on mental health. Wow, those numbers aren't moving much right now. Maybe people are still trying to figure out if they're how to answer that one, but if not, that's a resounding 100%.
Yes, it is, and I think we'll probably see that number sit there at the 100%. And I think the really important thing to call out here is absolutely this is a fact. We're seeing the number of cases of substance abuse and mental health concerns on the rise across our communities and really across our state and across our country. And really, it's very important right now for us all to acknowledge that it's okay to not be okay in the current climate that we're in. There is a tremendous amount of stress and anxiety and turmoil that every single one of us and our communities have been faced with for a number of months now. And this isn't something that is just a sprint. Certainly those of us that live here in Central Florida are used to having to deal with hurricanes and other events, and those can be very stressful and can be very traumatic, and sometimes there can be devastating damage in the aftermath, but they're a time-contained event, relatively speaking, right? And yes, there could be another one. This has just been drawn on for many, many months, and it's going to continue for the foreseeable future. So right now, we really want to make sure that we encourage everyone to acknowledge that it's okay if they are feeling that stress and that anxiety and depression in dealing with the COVID-19 pandemic and the implications that it's had on them, both for their own health, for their family's health, as we look at the economic impacts, job loss, business loss. I mean, it is far-reaching as we look at the devastation that this has caused. And we really need to encourage those that are around us, if we see those signs in our friends and colleagues, to make sure that we reach out and we support them and we try to encourage them to get the help that we need. There are a lot of community resources that are available to help support mental health needs. AdventHealth certainly runs several mental health units, including Orlando and DeLand, that are closest to us. And it's really important right now to just acknowledge that this is weighing heavy on everyone, and we need to be there to have each other's back and to hold each other up and to get each other the help that we need as we navigate this difficult time.
Well said. Thank you very much. Next question. Fact or myth? Children are less likely to catch COVID. So for those of you who are not able to see the screen, right now it's looking at about a 70-30, 70% myth, 30% fact, actually 71-29. So the bulk of the people, regardless of how it moves a couple up or down, are saying that that's a myth.
Yeah, so that is dead on. The answer is that this is a myth. Children are just as susceptible and potentially being able to catch it as anyone else. What we do see with children is that they tend to experience much less severe symptoms, which is a very good thing for the kids impacted. But we have to understand, just like a lot of other virus impacts that we deal with on an annual basis. So take the flu, for example. Most commonly, children are impacted far less than adults. And particularly those that are at higher risk with other health comorbidities that could make it more difficult for their immune system to mount a response to that. And we see the exact same thing going on right now with the COVID-19 virus. And so while these kids are less likely to have severe symptoms themselves, they can get the virus. In fact, we've actually just seen some studies that have just come out where we're seeing a very substantial uptick in positive pediatric cases. And once again, this is probably some of that is there's been a kind of a heightened focus on testing children. In the beginning, that wasn't as much of a focus. But we are still seeing, thankfully, that their symptoms are much less severe. There's much less hospitalization involved with these pediatric cases, but they can spread the virus to their family. And that's the critical issue here. It can be spread to their parents. It can be spread to grandparents. And so while the children may not be as severely impacted, they could share it with family members that may have significant health comorbidities that put them in a very high risk category. And that's the real concern here with children catching COVID and potentially being able to then spread that virus. And while certainly we don't control nor have the final say in whether we should be back in school or not back in school, because there are a variety of factors that weigh in on that conversation on all sides of it, and I certainly can recognize that. What we do advocate for, and we've been advocating across the different markets that we serve, is to work very closely with our school districts across Central Florida, where AdventHealth is represented in particular, so that we understand what's going on from a hospitalization perspective. Do we continue to have adequate capacity to make sure that we can care for upticks and surges in potential COVID cases, which that's the position we're in today. What we did see, though, is coming off of the 4th of July holiday, a couple weeks after that, we saw our spike at the highest point that we've been at in the state of Florida so far in this COVID pandemic, as far as the sheer number of hospitalizations on any given day. We could see a spike come back up again as school restarts, where you start getting people commingling back together, and then that could be potentially spread to families and others in the community as a result of that. So the best things that we can do to combat that is keep that communication close with school districts to understand and make sure that our health systems have the capacity to deal with any uptick, if there is an uptick in new cases that need hospitalized care. And the other critical piece is we strongly encourage for both teachers and students to wear masks and to socially distance. So we talk about that socially distancing. That is a really, really important factor, and one of the most important things you can do, maintaining greater than 6 feet. The CDC guidelines around high risk exposure are actually being within 6 feet, so closer than 6 feet to an individual that might later turn out to be positive or be positive with the COVID-19 virus, and being within that 6 feet for greater than 15 minutes. That's your highest risk exposure category. So obviously in a classroom setting or any other place, in a place of business, if you're going to be less than 6 feet for greater than 15 minutes, you need to do everything you can to minimize those impacts, and you certainly need to be wearing masks when you are going to be in those circumstances where you can't maintain that social distancing. So I think that kind of runs down a lot of the key issues around children and the COVID-19 pandemic.
I think, we became a little complacent, as we were watching this and thinking if we were around people we knew, it wasn't going to be an issue. So I think that your information on making sure when we're in family settings that if we can't, apply by all the rules that you've said, the potential of them carrying that to somebody else in their family it could be a high risk. And I think we've seen a little bit of that going on, where a lot of the spread that has been kind of traced has been back to family gatherings and, not necessarily, in a business at this point in time. So it has been interesting to watch that complacency come about. So what a great reminder. We all want to be with our families. We all want to hug the children and our grandparents and our parents. And I think it's really important for us to remember that. We do have a program coming up on Thursday that we are going to be talking about its impacts in education and the workforce. So that'll be an interesting one for anybody that wants a little bit more deep dive into what's going on in the education system. I did hear today that they will stop general testing and then move into just testing students and teachers. I don't know if you heard that today, David.
I hadn't heard that yet, but one thing you've always got to remember with this pandemic is things can change by the moment and by the hour. So,
well, thank you. Okay, let's get to the next one. Fact or myth? If I have already been exposed or had COVID, I don't have to worry about catching it again.
had some early voters jump out with a pretty resounding opinion on that.
I think that no matter how people start answering this, it's going to you're going to see where most of the people are answering. It's in the 90s as far as this is a myth. And again, I think early on this was part of the conversation that once you got it, you were done with it. And I don't know. Are you going to tell us? Is it a fact or is it a myth?
Yeah, so this right now is a myth, and there's a lot that we don't know about the COVID-19 coronavirus. It is something that we get more information out on a daily basis as worldwide research is going into this. But right now, the best estimates that we really have is that you probably have immunity for 3 to 6 months if you've already come down with the COVID-19 virus. We don't know for sure if it extends much longer than that, because we don't have a long track record of being able to study this virus, certainly. But you can make some assumptions around how our typical immune response reacts to virus transmission and exposure. And so we would anticipate right now that people probably have 3 to 6 months of increased immunity. But that certainly is no reason for them to be careless as we continue to see such widespread community transmission, particularly as they might get out on the longer time frame from when they had their positive testing results. What we would strongly encourage for individuals who have been tested positive and have had coronavirus already is to consider donating plasma. Plasma is one of the real breakthroughs that we've been able to take care of really, really sick patients that aren't responding to any other therapies in our ICU levels of care. And we've been fortunate within our health system to be some of the first to provide plasma therapy to patients from very early in this pandemic. And it can really be a lifesaver for individuals who haven't responded to some of the other courses of treatment out there. So just a kind of a community bulletin for those that have had it, or for if you know people that have had it, to definitely take a look at being a plasma donor, because you could potentially save a life through that gift back of the plasma. And continue to be cautious. I mean, be wise with your decisions at the risk that you put yourself into. Like we've talked about earlier, wearing the masks, doing the social distancing are really the things that can certainly continue to reduce your risk of getting it again. And we will get more science out on this, I'm sure, in the future. But right now, we should not hang our hats that once you've had it, you would never get it again. Because the other thing, these viruses can mutate. So we could get some mutation of the virus that could allow you to be susceptible to it again.
So David, if somebody goes in to give plasma and they find out that they don't have antibodies, but they did test positive, is that because they might have had a false positive, or what would be an indicator of why they wouldn't have the antibodies?
Yeah, that very well could be the result of a potential false positive. What we're finding with the testing on coronavirus is a lot of the tests, particularly the positive tests, are accurate, but every now and then there are some false positives, and some of them get widespread media attention. There's been some athletes in recent months that have had a false positive or perceived false positive that has kept them out from competing in different events and different things of that nature. But typically, the highest risk is actually getting a false negative. So some of the testing, particularly when it's just an antibody test versus the PCR test, which is really kind of the gold standard that detects viral particulates, and that the antibody test, you're much more likely to miss a positive result. But when you get a result back that says it's positive, most of the time on both the antibody or the PCR, and we're talking most of the time in the 99 to 100% range, so it's very highly accurate for the most part, you should consider it as a positive result. But, you know, with testing, we had tons of manufacturers rushing to try to develop tests, and we probably have set records for the fastest tests being developed in response to this virus. So anytime that happens, there could be some gaps in testing. And so people need to be wise to that as well. If they have all of the other symptoms of a COVID-19 virus response, they might need to get retested again if they have a negative result, but they're still showing a lot of other symptoms that are going on. So I think that's something that's going to be probably one of the bigger drivers. Someone might have had a false positive if they show up to do antibodies, or some people don't mount as much of an immune response. So it is theoretically possible for them not to show up with as much antibody activity as others would.
And before we go on to the last fact or myth question, certainly if there's people that have questions, go ahead and put them in the chat room. As we look at testing, is there one test that's better than another? Because you hear there's a variety of testing, whether it's the swabs or blood or what it is. Is there one that you believe will be more efficient or more accurate?
Well, right now, what we have seen in the data is the PCR tests, which are typically a swab-based test. There's a variety of swab methodologies, and it depends on the testing platform as far as which swab methodology you need to utilize. So some are oral pharyngeal, some are nasopharyngeal, some are mid nose swabs. And all of those do a PCR test, which is really where they amplify the virus, and they're looking for virus particulates. So it's really looking to see, are there virus particles that are being detected in that sample? And that has so far been the most highly reliable test that we have in fighting this pandemic. The antibody tests have been coming along, and there's a lot of promise for the speed and the expansion of those antibody tests. But those are the ones that have been at the highest risk of turning out false negatives. And so sometimes they can miss some cases. And that's the concern with those. So if you've got all the symptoms and you can get access to an antibody test, but you can't get access to a PCR test, get the antibody test. If it turns out positive, then you pretty much definitely probably have the virus. If you still have all the symptoms, you did an antibody test and it shows up negative, you might need to pursue an additional test and follow up with your healthcare provider for a confirmatory. You know, certainly the worst case scenario is someone has a lot of symptoms of COVID, or they have known high risk exposure potentially themselves. They go and do an antibody test and they say, oh, it showed up negative, so I don't need to worry about it. And then they go on and do, you know, large gatherings with families or other things, and it could be a false negative result, and they could end up transmitting it to a lot of others. So people need to be cautious. The testing has come a long ways. I think we're going to make a lot more testing progress in the coming months. To have more testing available and more testing available at a local level. I know it's something that AdventHealth has invested millions of dollars in bringing testing capability close to home, where we can run rapid tests here immediately in our community. But with the worldwide demand, that's been extremely hard to do. So folks and laboratories, both within hospital systems as well as just freestanding labs, they have platforms, we have platforms. Our biggest limiting factor is really access to the reagents, which have been moved around by the government based on where the virus is spread and where the biggest demand has been since the pandemic started. So that's my kind of quick rundown on some of the different factors related to testing.
Thank you, I appreciate that. Let's go to the last factor myth before we hit the chat questions. And the last one is it safe to seek care at an emergency room? And I should rephrase it, it is safe to seek care at an emergency room is what the question says. I apologize for that. So again, for those of you that can't see the screen, it is safe to seek care at an emergency room. 92% of the people are saying that's a fact.
Yeah,
You have a smart audience, David?
this is a very smart audience. They nailed that one. That is a fact. And there's a couple of really important things to keep in mind related to this. So certainly this is something that we have been very intentional and focused on from the very beginning of the crisis, really all across healthcare and in any health system. But this is not a new virus related, it's a new virus certainly, but we deal with viruses all the time. And so from our team members' perspective, they go through very quick screening processes and isolate patients that are potentially coming in seeking care for COVID. And they're doing that to keep others that would be visiting the ER safe from potential exposure. The other thing is constant sanitization of the area, certainly high touch surface areas and in general around waiting rooms and other care areas to make sure that we do everything possible to reduce the spread of transmission. One scary piece around people not seeking care, and we saw this a lot very early in the crisis back in the late March and into April and May, is we had individuals wait until they were severely ill before they arrived at the ED. And so what has happened with that is you end up having people that put off care to the last possible moment, and then they compromise their potential chance of getting life-saving services that could change their health outcome. And so certainly, the other disease processes that we deal with on a daily basis, heart disease, heart attack, strokes, cancer, none of those things take a break just because COVID-19 is present, unfortunately. And so we need to make sure that individuals that need that care, that they don't wait too long to come in and get access for that care. And I know we're going to continue to do everything we can to keep everyone safe as they come in and seek that health care for whatever issue they may need to seek it for.
Yeah, that's been a critical issue early on with people, not wanting to go because they wouldn't be able to be with their loved ones in the hospital setting. So, but boy, that getting in early is oftentimes the most important thing. So, we have the confidence in our healthcare system that they know how to deal with this. And, again, this pandemic is different, but our hospitals do it all the time. So we appreciate that.
Yeah, and Nancy, you touched on a really important topic because very early on, we did have the visitation restrictions, and we still operate under limited visitation, but we do allow one visitor per day. For pediatric patients, that's 2 visitors per day. And the reason for still the limited visitation is, once again, we want to reduce any potential risk of exposure to them as well as to our team members, because they could be positive bringing it into the facility just as much as the other way around. And so it's a safety measure on all sides, but we realize how important it is to have a loved one there to support you as you go through whatever your health issue may be. And so we're doing everything possible to work within the constraints that we're having to deal with.
Great. We do have a couple of questions in the chat room. One is, where do you go to get a test to see if indeed you have had the virus but now have no symptoms?
So right now, that test would be an antibody test that you would be looking to see if you had already had the virus, right? And so there is a couple of places, the tests that have been being conducted within Volusia County anyway at the fairgrounds, those have been antibody-based testing. So that's really the best place right now to go from an antibody perspective. We have been working at our AdventHealth Center Care locations to bring up an antibody platform that's available there. But that's not widely open from a full capacity perspective. Once again, we're trying to ramp that up. So right now, it would be that the testing that's been conducted there at the Volusia Fairgrounds would be the best access point. And we're trying to open up more testing access all the time to make that more available.
Great, thank you very much. You had mentioned earlier that you deal with a lot of viruses. What is making this one so difficult?
Well, the real issue with this virus is the high transmission rate. So when you look at a typical flu virus, while they're quite contagious, and if you have a colleague that comes into a business setting with the flu, there's a decent chance and risk that it could get spread to coworkers and colleagues in that setting. But it's never as highly contagious as what we're seeing with this COVID-19 virus that has come out. And so it's the transmissibility that we're getting from this virus. There's really a very low immune response in the general population, although interestingly enough, when we're starting to see some more scientific data coming out on this, there's a lot of asymptomatic carriers of COVID-19, which is part of the spread of this, which is also very difficult because people are unknowingly and innocently spreading the virus to others because they're not showing symptoms. As we're getting more and more research out on that, there's a chance that those individuals have had exposure to other coronaviruses in the past that have allowed their body to mount an immune response to keep them from actually exhibiting the symptoms of the virus themselves, but they're still carrying it at that time, and therefore they can pass it on to others, which is another reason this is such a high risk virus, is because we have so many, up to 40% is what some of the numbers are showing, could be asymptomatic spreaders of the virus. And so if up to 40% of the people that are passing it on have no idea they have it, it's really hard to control that other than masking, maintaining social distance, and doing all of those other safety measures to try to stop the spread.
So there's been a lot of discussions about herd immunity, and we've all heard different measurements for that. Do you even think that that's a possibility in the U.S. that we'll ever hit herd immunity on this?
Well, I think eventually, yes, we would. The question is what's going to happen first? Are we going to get herd immunity, or are we going to get a viable vaccine to try to stop the spread of the virus? And so, that's another challenge with this virus, is it's highly contagious. It can hit some individuals very, very hard, particularly those in high risk categories with other comorbidities. But the other factor with this virus is you look at viruses like the Ebola virus. It's fairly easy to contain that, even though it's highly transmissible as well. It's extremely deadly. So the less deadly a virus is, but yet when it's extremely transmissible, it's going to spread faster in the population because it's not as easy to contain it. And as we just mentioned, there's so many asymptomatic carriers that could be spreading this. So it's very possible that we could get to a herd immunity from just general exposure in the population. I hope we don't end up getting there, because that means a lot of people are going to end up getting sick across the country. Obviously, a lot are. But there's a lot of lives that can be saved by doing the safest things we can, by wearing masks, socially distancing, and doing everything we can to protect our loved ones in our community.
Great, and I'm going to go with one final question here, and then allow you an opportunity to close up and add anything we might not have asked or that you might not have thought about. But, as we're looking at the fall season, and there's a lot of conversation right now where the fall flu, coincides with this pandemic, and we can't hold you to any predictions on this, but what are your thoughts? Or, do you see this being a collision of two diseases that it's going to be very difficult for the community?
Well, it's a great question, and really, obviously, the jury's still out for sure on that. But what I think we would see is if people take the safety measures seriously that are being put out there, that are being recommended by the CDC, of masking, of social distancing, we're actually going to see probably a lighter flu season potentially than we might see in other years where people are being careless. They're not thinking about washing their hands. They're touching their face. They're not wearing masks and all of that. So obviously, that's what's hopefully going to happen. We've already seen some early indicators in the Southern Hemisphere where it's already winter in their flu season, and they've had some lower responses to the typical seasonal flu. But it only works if people are being very conscious of taking these precautions, wearing masks, washing their hands, maintaining social distancing, if we do all of those things, we should hopefully be able to keep both under a level of control that will allow us to safely care for our communities, where we won't overburden and surge the healthcare systems, and get through this together.
Thank you. We appreciate all of the information. We are blessed with an incredible healthcare industry in our region, and we do appreciate everything that you are doing, and that the healthcare workers and our first responders and everybody that's out there just doing everything they can to get us through this. Is there any closing remarks you'd like to make? Anything we didn't touch on?
Well, I just want to, share with you all that we are continuing to grow and expand our team of loving caregivers. We brought in team members from really around the country to make sure we have adequate resources here to support our communities across Central Florida with the COVID-19 pandemic. And we've never been more ready to serve this community with the potential future rise in these cases. We have hundreds of additional ventilators on hand that we're able to respond to those issues. Our team has done an incredible job, and I really can't thank our physicians and nurses, our frontline team, that every single day is there caring for patients, putting their own lives at risk, and caring for this community in a loving way. And I'm very grateful to them. Certainly those that have done that around the world. And I just want everyone to know that we're here to serve this community regardless of what's ahead of us. And we want to stay safe together. So thank you for this opportunity to come on and share this information with you all today.
Well, David, thank you very much. And thank you to all of the participants. Obviously, the more that we can all work on this together, the quicker we're going to come out of this. So hopefully you will take the information you've learned today and share the facts and not the myths as we move forward. And we look forward to seeing you at upcoming programs. Again, thank you. Thank AdventHealth for being such a great trustee member of our organization. And we look forward to being a partner with you in the many years ahead. So thank you very much, and everybody have a great afternoon.
All right. Thank you, everyone.